as the number of confirmed coronavirus cases in the U.S. reaches over 1,000, while 29 people have died in the country. Now, public demand for test kits is on the rise. Here to discuss this situation further is emergency medicine physician Dr. Mark Bruce. Thank you so much for joining us.
You're welcome, Stephanie. Good to be here with you. I wish we could talk about something else besides this.
Exactly. It is affecting the economy, it's affecting markets, it's affecting so much. But of course, safety remains the #1 priority for all these people. And although thousands are infected with the coronavirus worldwide, World Health Organization officials have still not categorized this as a pandemic. Why is that?
Well, I think you have to look at the definition of a pandemic. Basically, it's an epidemic that takes over an entire country or the global community as a whole. And we really aren't there by definition. However, I think it's almost a moot point because everybody's acting like this is a pandemic.
Right, and we know that officials here, or World Health officials, they've actually said that it is close to becoming a pandemic, but they're still holding off on actually categorizing it as that. Now, as many people have fears of being quarantined, some are stocking up on things like water and toilet paper. Do you think the media have exaggerated the dangers of contracting the virus?
I really do. I think that there's been an awful lot of hype associated with this. And you know, the panic many times can be actually worse than the disease itself. And it certainly is a bad disease if you get it and get very sick from it. But the vast majority of people that contract COVID-19 are going to do quite well. They're going to have a mild illness and completely recover. But we know that there is this group of people that are very vulnerable to the severe form of the disease, getting the pneumonia, and then going into respiratory failure and succumbing to that. Those are the people that have chronic diseases or are immune compromised, and the elderly. The young people usually are spared from this. If they get sick, they have a very, very mild form of the disease. And I characterize young as being both a pediatric population, but also those probably under the ages of 45 to 50. It's in that 70 to older population that have that chronic disease, hypertension, cardiac disease, diabetes, or are immune compromised because of chemotherapy or cancer treatment that are really at very, very high risk for doing poorly with this disease.
Now, some people have purchased face masks to prevent themselves from getting the virus. Do you believe wearing a face mask is the best way to prevent from contracting the coronavirus?
I think sensible precautions are probably the best way. And sensible precautions are doing the things that your mother told you to do when you had any kind of cold. You wash your hands a lot, you cover your mouth when you cough, you drink lots of fluids, you don't share drinks, you stay out of people's faces. And the masks actually do two things. First of all, it does present droplet spread because this virus is carried primarily, at least as far as we know right now, by droplet spread. So it does kind of keep that from happening. It doesn't completely protect somebody that is not infected, but it does another thing that really does help limit spread, and that is it keeps you from touching your own nose. I'll give you just a brief anecdote. We have masks in my emergency department outside each patient room. We've had to remove those masks because we found that patients and their families were taking the entire stack of masks with them when they would leave. And so it left the hospital staff not able to adequately protect themselves. And so now those masks are contained just in the treatment stations, the doctor's offices. So that's just kind of one example of the fear factor associated with this, and maybe some false hope that people have that if they wear a mask that it's going to completely protect them.
Want to see more videos like this? Click on the link below and subscribe to One American News on YouTube, and call your cable provider and kindly demand that One American News is added to your lineup. Call and subscribe today.